welcome back to the channel. I'm Ariza, a licensed clinical social worker with over a decade of experience helping people just like you pass the LMSW and or the LCSW exam. So whether you're a first timer or repeat test taker, this is the place to get the tools, strategy, and the mindset you need to level up and pass that exam. So let's jump into it. Today we're diving into a very important topic in mental health, and that is bipolar and its related disorders. So as a licensed clinical social worker, I've worked with many people who've navigated these complex conditions, and I'm excited to kind of share you some insights on how to identify which is which and so forth. Let's talk a little bit about bipolar. Bipolar was formerly known as manic depressive disorder. So if you have a grandparent or somebody older, or I don't know, maybe even a parent in your life, or maybe even you, and you be like,
that person's manic depressive, and you're like, what the hell is manic depressive?
That is the term that bipolar was formerly known as. But of course, in today's day and age, it's been decades that people have been using bipolar disorder. Bipolar disorder is a mental health condition categorized by extreme mood swings. These swings include emotional highs, which is the mania or the hypomania, and then the lows, which is the depression. It's important to note that these aren't just typical ups and downs. These are severe changes. Like,
they're causing significant impact in the person's daily life or relationships. Like, this just ain't no normal high. It ain't no normal low. This is pretty extreme.
And there are several types of bipolar and related disorders. So the first one is bipolar 1. That is the most intense one. This is defined by those manic episodes. So mania is normally defined by 7 days or more of that severe, intense activity where the person's overspending, not sleeping, just a lot of intense stuff. Check that out in the DSM because it's definitely a difference between hypomanic and mania. And then also when you see somebody needs to be hospitalized for the condition, you're normally thinking bipolar 1 because typically a hospitalization is necessary. And then they do have that depressive symptoms would last for, at least 2 weeks during that duration. Now we have bipolar 2 disorder. This involves a pattern of depressive episodes and hypomanic episodes, but it's not the full-blown one like you see in bipolar 1. It's a little milder. It's like the baby bipolar. Somebody's gonna get me for saying that. So not baby bipolar. It's just not as intense. All right. And then you have cyclothymic disorder. This is categorized by numerous periods of hypomanic and depressive symptoms. I like to think of it as a cycle. And it lasts for at least 2 years in an adult. So if an adult has these highs and lows that just cycle like that, you're looking more at cyclothymic disorder. And if it's in children and adolescents, they only need to have that for a year. Now, there are some other specified and unrelated, or should I say unspecified bipolar and related disorders. These are categorized and are used for bipolar disorder symptoms that just don't match those 3 that I shared with you. So let's talk about some of those experiences. During a manic episode, a person might have increased energy, the activity level might be extreme, they might have exaggerated self-esteem or grandiosity. They might have a decreased need for sleep, like they just don't need no rest. They just on a high and they just like way up there and it's hard to reel them back in. They might also have that increased talkativeness. They might have racing thoughts. They might have distractibility and also some risky behaviors. This is where you hear people who are normally like hypersexual, just out, just doing the do with a lot of people. Maybe overspending, just really, this is that manic. They're just like all over the place and it's really hard to reel them in. But on the flip side, you have those depressive episodes, and that can include where the person's feeling sad, they're feeling a sense of emptiness, hopelessness, they don't have an interest in doing certain activities. Normally, you'll see some physical symptoms like significant weight loss or weight gain. They can have the insomnia where they're sleeping a whole lot or sleeping very little. They can have fatigue where they're just tired and just have a loss of energy, not really wanting to do much. And then they also have those feelings of worthlessness or just maybe excessive guilt. Some other symptoms might be difficulty concentrating, and then of course the one you really need to look out for is thoughts of death or suicide. Yes, having those suicidal thoughts, and that is something you definitely want to hone in and make sure you're paying attention to. It's also crucial to understand that bipolar disorder is a serious condition and it does require professional help. So if you know someone, you're working with a client and you don't have the tools and ability, because remember as social workers, we have to be competent in a certain area, make sure you refer that individual out and make sure they get the professional mental health treatment that they need. The exact cause of bipolar disorder, it isn't known, but there are a lot of factors and functioning that people look at or say could be involved. These include genetics, maybe the brain structure and the functioning. There are some environmental factors like stress and trauma. So the diagnosis of bipolar disorder involves more intense evaluation by a mental health professional, and it typically includes like a detailed history, a physical exam, and potentially some lab tests and other stuff, because you want to rule out all other type of medical conditions before you just pop up and say you got bipolar disorder. So these are the things you want to be mindful of. Now, treatment, this is important. The treatment for bipolar disorder usually involves a combination of medication and psychotherapy. So if you have a client you're doing therapy with and they have bipolar, it's not going to be as effective if you're not able to make sure they're on some type of medication regimen as well. So medications could include some mood stabilizers, some antipsychotics, and some antidepressants. It just really depends. And some type of therapy approaches, or should I say that approaches that you would use with the individual in using psychotherapy would be CBT, cognitive behavioral therapy. And then they also have interpersonal social rhythm therapy. That's IPSRT. That is highly effective. And that's not as common, so you might want to do some research before you jump in and say, let me use this. Maybe take some CEUs or something so you're comfortable with it. But just remember, people living with bipolar disorder, it can be very challenging for them. They need the treatment, they need the support. A lot of people can lead fulfilling lives and they can be productive, but it's important to understand what's going on and how this diagnosis can affect them. So they want to stick with a treatment plan, want to monitor their sleep patterns, want to avoid alcohol and drugs, and just learn to recognize these signs of when this person is going into one of these mood episodes, whether it's a depressive one, a hypomanic, or manic one. You definitely want to be sure that it's also the individual has a strong support network. That is very important. So just remember, bipolar disorder, there's the three main things we want to look at: bipolar 1, bipolar 2, and then you have the cyclothymia. They are similarities in those disorders, but again, you can rewind the video, you can go back and be able to tell which one is which. Again, bipolar 1 is more intense than bipolar 2 because bipolar 1 has one more symptom that bipolar 2 doesn't have. That's a little cheat I give my supervisees, and that is bipolar 1 has the manic. Bipolar 2 does not. So that is that one more symptom that bipolar 1 has that bipolar 2 doesn't. All right, so keep that in mind. As for today's video on bipolar and related disorders, I hope you found this to be hella helpful. Remember that it's important to understand this for not only the exam, but also for your mental health and also for the mental health of the people you love and the people you provide services to. Don't forget to like this video, don't forget to subscribe, and definitely hit the notification button because your girl is putting at least 2 videos out here a week, and I need you to be notified. So if you're in the car driving, you working with your kids in the kitchen cooking up something, I don't know what you're doing, but you need to get that notification so you can say, boom, she done hit us with another video. Make sure you study, make sure you're prepared, and if you need more intense help and more intense support, make sure you go to the bio section of the description, learn more about our course, and you can get the nice little colorful template that you see over here on the screen that's showing you all the different bipolar disorders, how it looks and so forth, so you can use it as a cheat sheet and download it and be able to use it and make sure you have an effective study strategy. I hope this video was helpful for you. Until the next one, you be blessed and take care of yourself.